I think it's great that we're here today working in a bipartisan way on bills to improve our healthcare system and continue to lead the way in developing cutting-edge medical research. But I can't help but notice the irony that we're doing so after Republicans made the biggest cut to Americans' healthcare in history. These bills we're going to consider have strong bipartisan support, but the impact they're going to have will almost be totally eclipsed by the 15 million Americans who are going to have their Medicaid and ACA health coverage taken away because of Trump's mega bill. That's not to mention how the administration is systematically dismantling our public health infrastructure, withholding funding from life-saving medical research, and actively spreading misinformation about vaccines that keep our communities healthy. I sat in this hearing room along with many of you through the night as my Republican colleagues rejected amendment after amendment that Democrats offered to improve the health of Americans and lower their health care bills. One of those amendments was to extend the Enhanced Affordable Care Act premium tax credits that are set to expire at the end of the year. Republicans voted against that amendment. The expiration of these credits will result in an enormous premium price hike on millions of Americans. In my home state of Washington, people who receive the subsidies are going to pay 65% more next year for their monthly insurance premiums if Congress doesn't continue these enhanced subsidies. That skyrocketing price increase is going to force 80,000 Washingtonians off of their health care coverage. Remember the kinds of people who get Affordable Care Act coverage: small business owners, part-time and gig workers, and younger Americans. I was with a small business owner from my district last week talking about the importance of these subsidies. She talked about having exchange coverage allowed her to focus on growing her successful business. She has a family and a business partner. She wants to stay healthy and for her family and business partner to stay healthy. But if these subsidies expire, her premiums are going to double and she'll have to dip into her retirement just to afford her monthly payments. These are the kinds of people who'll be hurt if we allow this to happen. And if you think this is about saving money, you're completely wrong. There's a massive cost to everyone when people lose access to care like this. ER rooms fill up with uncompensated care. Facilities close, and everyone else pays the bill. When people can get preventative and primary care, we save money and lives across the country. So while these bills we're discussing today are important, this markup is missing the mark. I'm disappointed the Republican majority is so at ease letting their constituents' health care coverage become unaffordable. I'm going to keep pushing to extend them and make them permanent. Those subsidies are critically important. Thank you, and I yield back.